Last week, Governor Brian Kemp pleaded with Georgians to strictly follow safety guidelines like wearing a mask and social distancing in hopes of flattening the case curve over the next 4 weeks. Caitlin Heck breaks down the latest data to see where the state stands now.
Let's start with a big picture look at the state data since the start of the pandemic. These numbers are as of Sunday. Now, since the beginning of June, we've seen a pretty drastic increase in new cases each day. However, we're noticing a small dip in the curve right before this section of preliminary data in orange. This section represents data the state is still counting and will continue to change as each state moves out of this 2-week window. But this short dip is the first we've seen like that in more than a month. However, Michael Hawkinson with the North Central Health District tells me some smaller labs are taking anywhere from 1 to 2 months to report data to the state. So even areas outside of this section are subject to change, just likely not as drastically. Even if this downward slope holds true, as of July 6th, the state is still averaging about 3,100 new cases a day, 4 times the peak back in April. Unfortunately, hospitals across the state are not seeing much relief. This data shows we're averaging 250 hospitalizations, up from 212 just last week, and well above the peak of around 180 in April. 3 of Central Georgia's biggest hospital systems made a plea last week for you to follow safety guidelines to keep their hospitals from becoming overwhelmed with cases. While COVID-related deaths appear to still be dropping overall, there has been a slight uptick in the last 2 weeks, though that is again within the state's preliminary data period. We've also seen this data lag behind other indicators because of the time it takes for the state to get reports from coroners, hospitals, and through death certificates. We will continue to track all of this data and, of course, bring you the latest updates. I'm Caitlin Heck.